let's give our panelists the opportunity to tell a little bit about themselves, especially what is your research focus and which aspects of your work are community engaged. And it would be amazing if you can give us an example of a community engaged method that works well in your field of work. So let's start with Dr. Spurlock.
Good morning, everyone. Actually, if I could invite Cameron to also present with me, because a lot of the community engaged research I've been doing is with Cameron and others with communities in partnership. So Cameron, do you actually want to start?
I can start my introduction. Cameron Smith. I am one of the co-founders and the executive director of Communities in Partnership. We're a majority Black and a majority woman-led and founded community development organization. We focus on creating liberative economic development frameworks at the intersections of social determinants of health. We're place-based here in Northeast Central Durham. In terms of the kind of beginning focus of our work, but we have since grown both citywide, regionally, and nationally in our work. We focus on areas of housing, economic and community development focused on food systems, entrepreneurship, as well as our food systems component is the largest breadth of our work, with both having market rate strategies as well as opportunities for communities to kind of come together and create our own economic systems together. Housing, we have a Black think tank as well as a transformative justice arm as well in the work that we do. Dr. Danielle, do you want to add anything?
I am a land use and environmental planner by training. I also come with a public health background. For those reasons, environmental justice has been central to the work that I do with CIP. In particular, we were most recently looking at what has been or hasn't been done around park equity in Durham, and what does it look like for us to trace a thread through the work we've been doing for years, because we've been working together since 2016. Is that right, Cameron? Yes.
Began 2015 into 2016. Yeah, we did. Yes.
Trying to really tease apart when we look at areas within our cities, within our urban areas that have and are continuing to experience disinvestment. What are the many systematic levels at which we need to tackle that problem? So looking at both the policies and procedures, resource flows, looking at relationships, but in particular looking and trying to tease apart and dismantle many of the narratives that justify the disinvestment or the reason why we see certain things progress going forward. Why is it okay that there's 3 asphalt plants in Old East Durham? Why is it okay that when Bryn Tag had their unfortunate spraying out on the highway, that's when it gets attention, and because it was peeling the paint off of cars, but there's not the same interrogation to their operation within a residential area. So covering topics like housing, park equity, urban tree canopy, really trying to create a more holistic approach using any number, like some of the speakers on the previous panel, a number of different approaches. So community mapping, community workshops. We have a photo voice project that we're doing an exhibition of next week. Surveys, focus groups. So really layering those techniques as we are trying to build the body of research that enables CIP and others to continue their advocacy work. They're going to advocate whether or not the research is done, is helping push back against some of those larger narratives about who has expertise and who you're willing to listen to.
Thank you so much, both of you. Dr. Feldman, go next.
Hi. Thank you so much for including me in this conference. I'm really humbled by the work that everybody has presented so far, so I appreciate it so much. My background and experience, as Dana said, is in global public health and nursing at the community level, both globally and locally. And the focus of my current scholarship is in the area of mental and psychosocial health, and more specifically on stress and resilience in refugee and immigrant populations here in the US. And I also have a current global work in Tanzania centered on a rural community there on the border of Kenya, where I work with an organization which sponsors children orphaned or displaced by clan violence, HIV, and FGM. That's female genital mutilation. And also includes a local community-based medical center that I'm helping to support and develop. Two of my recent doctoral students have completed their scholarly projects in that setting in Tanzania. One most recently was an intervention training teachers to identify mental health issues in children that are at the children's home there. So in terms of like community engaged methods, we work really closely with the community in all the work we do here, both here in the US and abroad. And broadly, we follow the CBPR method or model, which is community-based participatory research, and that recognizes the strength of each partner that you work with, supporting equal community participation in research, and hopefully for which they will directly benefit. So it's a whole process that you go through, and I'll explain a little more about that later. But our team has long-term sustainable relationships like yours, Cameron and Danielle. We work with El Centro Hispano, we work with El Futuro, we work with Church World Service refugee and immigrant population, and have long-term relationships with them. So we look at including members of those organizations in our research teams as co-investigators, as well as training community members and community health workers in research and intervention methods. So that's one thing that we really focus on strongly. And our ultimate goal is to establish, as everyone else, culturally appropriate, sustainable interventions and programs that are evidence-based, which is why we do the research in the first place. So, and the point is really to accelerate that translation of research findings into the community rather than leaving them on PubMed or in the literature. So I think that's in general an introduction to what I do.
Thank you, Dr. Kalsman.
Sure.
I'll pass on to Dr. Katti now.
Hello, and thank you for inviting me to this. This has been really enlightening to hear what everybody's doing. And I feel like I might break the rhythm we have here because I brought some slides, if that's okay, just to talk about what I do. So, all right, so I describe myself as a reconciliation ecologist with the goal of essentially reconciling humans with nature, but in the context of how unjust and unequal our world is through histories of colonization, imperialism, structural racism, and various things that are happening now that result in this unjust world. And my goal, as somebody trained in ecology, to bring what I know to try and help find solutions for reconciling humans with nature. How do I do this? Well, I sort of have three different strands in my work, which is also tending towards activism more and more. So one major part of my work, especially in the last 25 years or so, is in urban ecology. I was trained as an ecologist. I studied birds, for my PhD. I'm originally from India, from Bombay. So studying nature in cities kind of came naturally. And I've been studying cities as complex social ecological systems And my broad focus is on understanding how urban biogeography, which is the distribution of organisms in urban spaces, is driven by human geography and history in the cities. So, how do socioeconomics and culture influence the distribution of nature and other species in cities, as well as how those elements influence human culture and socioeconomics? So, the dynamic interaction between those. And all of this sort of lends to community engagement in research, specifically through, there's been a history of citizen science kind of research, as it's been labeled, especially in studying birds. Among the oldest citizen science projects involved people monitoring birds. So I have used those approaches for studying, for documenting urban bird diversity in a number of cities. And if you're, live here locally, I'll show a slide, I'll give you a little bit more info about the triangle bird count in a minute. The second strand of my research is increasingly focused on environmental justice. And again, in the context of cities, looking at how inequality and histories of things like segregation, redlining policies in the US, for example, shape the distribution of tree cover and bird diversity, as well as access to nature in cities like Durham, where we were supposed to be today, but hopefully you're getting some snow there now. I'm also focused on how power, political power, economic power, shapes the distribution of nature and biodiversity, and how it constrains people's choices or gives people opportunities to shape nature around them. And I think I have a graduate student in a new sort of direction of research where we're looking at how displacement caused by climatic changes or political repression affects what people know about the environment, especially ecological knowledge in terms of knowledge of plants, animals, how to use them, cultural context. What happens to that kind of knowledge when you're displaced? And I think this is an increasingly urgent problem throughout the world with people being displaced. So that's something that I'm really interested in studying, and I can sort of see intersections with some of the work that others have talked about here for this. So I'll be, really interested in sort of pursuing those intersections if opportunities arise. And then a broader philosophical sort of strand of my research is looking at how we do science, what sort of methodologies we use in science, and how that is shaped by histories of colonization in particular. So my goal is in looking at science through a decolonial lens and looking at how we do research and how we teach science through that lens. And for that, I've developed a framework of 5 areas where we can shift our practice to move towards decoloniality. And I'm pushing my own research in that direction. I also, teach a class in decolonizing science here at NC State, which is open to grad students at Duke. And I also conduct workshops on decolonizing science. So if you want to know more about that, I'd be happy to come and do that. So just on the urban ecology part, this is a diagram that sort of illustrates the connections between urban structure and environmental justice and social justice. And I won't go too much into it because we don't have time, but I do recommend that you look up this paper by Chris Schell and colleagues that talks about how the history of segregation in particular has influenced ecology and evolution in cities. Cities are unequal places. And again, if you want to get visuals of this, I recommend going to this Unequal Scenes website that has some really striking imagery, aerial imagery that shows how inequality shows up in cities. In terms of looking at redlining, we've been looking at redlining and its effects on cities, and this is just a synthesis of a number of studies that have been conducted in recent years that show significant differences in the green lined or better graded areas versus the red lined or poorer quality areas where mostly black and brown people have been pushed when redlining was an active policy. And we can see even now that there are residual effects of redlining in canopy cover, in impervious surface, in noise pollution, in things like land surface temperature and air pollution. So a number of environmental variables continue to reflect a legacy of racial segregation in American cities. In Durham, this is a work done by my graduate student Jinbai, who's a postdoc at Duke now, and we looked at tree forest cover, or forest cover in the triangle. The colors indicate the different zones, and you can sort of see where the differences in tree canopy cover are. We also looked at impervious surface cover uh, and temperatures in the month of July. And this is just summarizing the data here. So looking at forest canopy cover, we can see that in Durham, the A-graded neighborhoods have higher canopy cover than the D ones. Some differences not as stark in impervious surface cover. We also have bigger differences in temperature, uh, uh, and we've also been looking at bird diversity and composition in Durham, where the differences are not as clear cut. If you want to know more about that, I'll be happy to talk about it. I mentioned the triangle bird count. This is a citizen science project that's been ongoing for 5 years now, with the exception of the pandemic year when we had to cancel it. And we've got some interesting data from this showing how, again, differences in socioeconomics and demographics are reflected in who participates in citizen science projects as well as in the distribution of birds across the triangle region. And one of the things that I'm trying to do is you make these tools like this triangle bird count, but also tools like eBird or iNaturalist, these apps that are freely available now, to engage communities that have traditionally not been involved in these kinds of research. So because bird watching and participation in these projects tends to be a white, upper middle class, older demographic, and we're trying to change that by approaching communities and engaging and also empowering communities to do these in their own neighborhoods, because it's important to understand what you have in your neighborhoods. In terms of decolonizing, I mentioned the framework that I developed with my South African co-authors, Chris Trissos and Jess Auerbach. And this is a framework essentially that calls us to change the way we do our work uh, in these 5 different areas: decolonizing our minds, knowing our histories, decolonizing access to science and the products of science, decolonizing expertise, as recognizing that people who don't have PhDs also have expert knowledge. And even though as universities we are in the business of granting credentials, we can't we need to recognize that there is other kinds of expertise that is valuable. And conducting ecology in more inclusive teams. Again, there's a word that's being censored now, but inclusion and engagement of diverse people and communities is really important. And finally, uh, I do also believe that as scientists we have to make some good trouble. I've been trying to do that uh, through my public writing. I even wrote about the election in Scientific American in an op-ed last November or last fall, and didn't have much of an impact, I guess. And this is a more provocative recent project, which is for a first-year class in NC State. We have this program called Wicked Problems, Wolfpack Solutions, where students take online classes to learn about different kinds of research people are doing on complex systems. And I created that video where I'm critiquing the national park model as a colonial project. And I was surprised that they agreed to post this video where I made the charge that Yosemite National Park is a colonial crime scene. anyway, that's an overview of the kind of work I'm doing, and I'm happy to, you know, engage in the conversation that we're having now.
Thank you so much. It's all really exciting. And lastly, I asked Dr. Grace McCaskey to tell a little bit about her community engaged work.
Hi, good morning. I just want to echo the sentiments of all of you. Thank you for the invitation. And I'm glad we were able to do this over Zoom, even though in person would be much better and more fruitful, but here we are. So as Dana said, I am an applied environmental anthropologist, but I have a sort of mixed background, kind of classic case of never expected to become a faculty member. And prior to coming to ECU in 2016, I worked for NOAA Fisheries out in Hawaii as a practicing anthropologist. So my work is largely interdisciplinary. That's why I was essentially hired at NOAA years ago, and then why I got the position at ECU. So I bring sort of the applied and anthropological perspective to projects with ecologists, engineers, physical scientists, geoscientists, really across the board, which can be really rewarding, but which is also really challenging sometimes. So in terms of my work, I think Dana provided an overview, but I use a political ecology and environmental justice perspectives to examine resource management institutions to see how social, political, economic, historic factors influence access to resources, participation in management processes. A lot of my work has been with small scale fisheries in the Caribbean, the Western Pacific, but also coastal management, and increasingly since coming to ECU, focused on water resources more generally. And as I said, it's typically an interdisciplinary approach in large research teams. And, I'm really I try to bring that focus on participation, on collaboration, and how to engage communities from, step zero, essentially. The extent to which my work is community engaged largely depends on the project. Currently, I'm on 2 of the large NSF Coastlines and Peoples projects, which are, 11 institutions, 60 people, just really challenging to for everybody to come together and work toward the same goals, regardless of what was actually written in the grant to begin with. We all know how complex and sloppy things kind of get when you're actually doing the work on the ground. And so depending on the project, often I feel like myself and my social science colleagues are sort of the ones that are constantly towing the line of, but what do the communities want? What do the communities think? What do they need? What are their goals? That it's not us as academics or researchers who should be defining the problems and the issues, but that we really need to know what the community wants and needs, where we can support them, and that we can't just automatically expect community members to want to work with us just because we're researchers. And so I feel like some of that was discussed at the first panel, so I think there's a lot of overlap there. And in terms of methods that I use as an anthropologist, I'm trained in ethnography, and so participant observation, informal interviewing, just hanging out. And some of you on the first panel talked about just showing up to community events, to being there, to understanding the people that you are living with, that you are working with, and not just assuming that because you're a researcher, you sort of have what's best, and communities should be excited to work with you. But in more formal sort of as the process progresses, I think in these kinds of approaches, then, you know, it is semi-structured interviewing or focus groups or participatory mapping, those kinds of things. I mean, any way to truly engage with community members on the ground level, it doesn't matter what that looks like to me, as long as we can do it ethically and intentionally. So, thanks.
Thank you all so much. The introductions were fantastic, and it's so good to hear from all of you, kind of both what you do and also where your passions lie and what you're excited about in community engaged research, which is so important. So now we're going to move into the question and answer portion, which will take many forms, but essentially we want to encourage you, if someone gets a question and you want to hop on and also share your thoughts afterwards, feel free to do so. I'll kind of wait a second before asking the next question. And we also really want to encourage the audience. So we have questions that we can ask each of these panelists, but we also really want to hear from you. So feel free to drop your questions in the chat. And for this first section, Ankita will be monitoring them, and I'll be asking a round of questions, and then we'll go from there in terms of what's in the chat, what you all want to discuss, etc. So very much we want to engage our community here in this conference as much as we can. So we'll start back off with Cameron and Dr. Danielle, since you all kind of introduced yourselves first. In communities and partnership and in the work that you're doing in general, you really focus on this community-rooted approach versus just community-based. And so we're kind of hoping to hear from you why that's so important, why the distinction exists and why it should exist in our work and in kind of the work we do in the future, and anything else you want to speak on from there.
You want to go first, Dr. Danielle, or do you want me to go first?
I can cue you up. I do think community-based research operates on a spectrum, and we have a lot of sources, a lot of good principles that have emerged over time. And yet there is a gap between intention and action. And so what I see community-rooted approaches doing is really putting up what I would call both signposts and guardrails to the actual practice. Because there's a lot of folks who will come and say they are using community-based participatory research. And we'll see, because we are still within a system within the university, systems of oppression, we still replicate many of those same systems. An example. When you come to a community and many CBPR researchers will say, well, what I did first is just meet with folks and we came up with a proposal and we sent it out, and I'm involving people from the beginning. Yes, but the power dynamics are tilted from the beginning. Some because of who you're sending your foundation to, the language is necessary. Some of it's also who's getting paid. Even if someone is not being paid, most likely if we are starting brand new scratch, we don't have any money. And the list goes on. So that type of interrogation of the community-based participatory research model needs to be constantly done because so much about the research practice, its institutions are going to draw us back into a very exploitative model that's just operating under a different name. So that is part of the reason why we have been pushing and trying to refine how we are doing something different when we talk about community-rooted research. And I'll pass it to Cameron.
Yes, Dr. Danielle says our framework infuses a power analysis. And so when Dr. Danielle and Dr. Kay Jowers at the Nicholas Institute and Dr. Kofi Boone came to us many, many years ago, we sat down in a room at one of the faith communities here, and we said, okay, we can understand why you want to be here, but what is this going to how is this going to benefit the community? Because what communities like ours is tired of is being used as lab rats.
Mhm.
As test subjects and people studying the quote unquote pathologies that exist within poor communities. And then get at this point billions of dollars in funding, and our communities are still at the same space they were before, or at this rate of the last 7 to 10 years. Actually, we are greatly regressing in our economic mobility and ability to keep up. And so what we're having is huge displacements, also increase of all sorts of negative impacts on people in our communities. And so that just is kind of fueling the fire. So we're just like, what we need you to do is help us to work our way out of a job, help us to build our communities in the way that they should be built. Because I believe in terms of the benefit of study is to actually solve issues, not to just study and study more and to have very high level conversations and suggest frameworks that have no applicability to what's being done on the ground. And so, part of it is what Dr. Danielle, coming from a directly impacted background herself, even Dr. K, when they come into this community, they're seen as part of CIP in the community. Relationships trump everything at the very beginning. And so looking at having a power analysis and analyzing what people on the ground living in that context and that community need, coming from three very well-resourced institutions, UNC, Duke, and NC State. The academicians that I mentioned were from those three institutions, and how they could actually leverage the privilege and the resources and accesses that they had to actually help us build an organization. Because when Dr. Danielle and Dr. K came and Dr. Kofi came, we were not a 501c3 or a formal organization. We were a group of community members who had just experienced a very traumatic event in our community a couple of years before that, and had been coming together and trying to figure out the best ways to move forward. And so what they were able to do from their perspectives in their institutional capacity was to help us build the frameworks to actually create a 501c3, to create a plan to actually see how we can actually own our own housing, to create a food systems plan, to create a framework for our community health organizers in the community to be able to actually serve our people in our community better, to have a community-based education process. And Dr. Danielle and I both were chosen to go to the University of Michigan, which is the nation's foremost expert on community-based participatory research. And part of this analysis, then Dr. Danielle, that was back in like 2016, wasn't it? 2017
Yeah,
we went.
yeah.
And that was so helpful to us because we, just as much as it taught us a few other things that we needed to learn, it more than anything showed us how we were different and how we needed to actually pivot the work that we were doing, because we were very different than a lot of the researchers and academicians, and also the communities that were involved in that fellowship for that summer intensive that we were able to take place in. And so it helped us to be able to create the language and more on the paper applicability to actually our community rooted participatory research framework that we have created and actually been living out and operationalizing since basically day one. Yeah.
And just real quick, one example of that would be within trainings, both at University of Michigan and other trainings I've done. It's often trying to make Cameron be like me. It's like, oh, we'll just do a short course on statistics. I'm like, why though? Like, I've done it for years. Yes, I'm in my lane. Just like I don't need to veer into Cameron's lane, where really what we want to say is a zone of excellence. If we are talking about a balanced partnership, we both spend as much time in our zone of excellence as possible, and it's integrated rather than, because I think that's just another way of seeing community folks as having a deficit. If I could just build up your skills in these areas, you'll be able to have this conversation. I think it's off. It is still using a deficit model where if our capacity building isn't around what the skills that they might ask for, instead it's the skills that we think they need to have conversations in these arenas rather than shifting what what the conversation is, how we're having it. So to Dr. Kati's work, how do we start decolonizing some of these conversations? So it's not getting you a seat at the table, it's recognizing the table is broken, rotting. Um, we should probably move to a new location.
Yeah, we want to build our own table. And just to back that up, Dr.
Yep.
Danielle's expertise is is very complimentary when people are allowed to do it because, the community, we have our own data. We've been collecting our own data for decades. And so, you know, looking at it from a holistic perspective is what helps actually reduce the numbers of people falling through the cracks. And it actually makes communities more healthy and whole and also teaches the community that we can actually heal ourselves. We actually working with folks like Dr. Danielle. We have the tools that we need, collaborating with Duke, with UNC, with certain people in those institutions that are like a Dr. K, that are like a Dr. Danielle, that are like a Dr. Kofi, to actually bring about the real change in our communities that is needed. And so that's been but you have to have researchers and academicians that in terms of their own humanity and how they go about are able to interact with communities in that way. And Dr. Daniel just put our first article in the chat, yeah, about our community rooted framework. Thank you, Dr. Daniel.
Can I ask a follow-up question, or do we want to, however you all want to moderate is fine by me.
Yes, if you have a follow-up question, absolutely.
Awesome. Yeah, I'm really curious to learn more about your approach. And one thing that we struggle with here in Greenville, North Carolina, at ECU is just the decades of mistrust and displacement, and that have fractured and in many cases just completely can't think of the word I'm trying to think of, but disallowed, meaningful relationships to be created between some of the local communities and our university. And so I'm curious if you have felt or experienced that as a challenge and how you have been able to overcome that, particularly ECU is not as well resourced as State and Chapel Hill and Duke, right? So I'm curious how you've been able to overcome any of that, or if that is still an issue for you all.
One is, and this is to the early conversations we had, all three of the early collaborators, Dr. Kay Jowers, Kofi Boone at NC State, we were already doing work in environmental justice. So the deficit that we work in trust with communities, one, I think each of us already had experience what that looks like, which allowed us to know that, I'm not going to take it personally. Why should you trust me? I'm affiliated with this institution. I have to show up and show you that that I am willing to do the reparative work that needs to be done. Because yes, we're in the hole, and I should be. It doesn't matter that I wasn't involved in some of the parachute research or parachute researching. I'm still affiliated. That's whose name is on my paycheck. So I think it is coming in, recognizing that, and then you have to show up. We are 9 years in. I've knocked on most, if not all doors. There's some new builds. I've done a lot of door knocking with community residents, block parties, cold weather clothing drives. I show up, so you start seeing me. It doesn't mean you should trust me. They could not trust me the next day if I cross the line. And that's actually how it should be. There should be those accountability structures where the fact that I am affiliated with the university, there are certain resources that I am not participating in the economic blackmail that many institutions have used in the past as a way of getting people to sign on to projects that they might not have wanted to do. And then it's also like, and that is talked about in the paper that we've put into the chat, Cameron lives in Old East. People know where Cameron lives. Like, if I step out of line, they're going to tell Cameron, Cameron's going to tell me because they're your neighbors. So it is the scale at which the work is occurring as well. And then, Cameron, do you have something to add?
And I cannot iterate the strength of relationships. And so that is a huge piece of the puzzle in terms of the work that we do. And so showing up not only for community events, but Dr. Danielle and Dr. Kay participated when my husband graduated from law school. I mean, the people support, we supported, we've been at Dr. Danielle's house and Anya's house for celebrating community events, and people discount that. But I think in this age right now, we need to really look at how we create systems that do not require that we bring our humanity into that space. And what does it do to those systems? And so I think we need to reorient ourselves, especially those of us that are involved in the human sciences. We need to reorient ourselves back to a way of being that brings our whole sense of humanity. And for some of us, the reclamation of certain places of those humanity, in which we've told that's what you're supposed to leave out the door when we've been trained to do that. But when we do that, it gets us the outcomes that we're looking at right now. And so we need to go back and reorient ourselves that we need to care about what happens in that community, because eventually it's going to come and knock on your door where it might be you that's the one that's suffering. And so how do we have those conversations and build those frameworks and also have healing space? Because as a practitioner, I live here. And like Dr. Danielle says, I live in this community. People know my address. They know my phone number. 3 of our 4 adult children live in this community. They know where they live. And so, and so we are really inculcated here. But also Dr. Danielle is coming from an institution that has been looked at from a negative perspective. How do we build a relationship that's holistic and also life-giving, that also benefits Dr. Danielle and that helps her to get in contact with her community and reclaim that sense of her humanity, so she's not having to separate herself from her community and her people in the work that she's doing?
I just want to say that I loved hearing that, and as someone who has an immigrant here and have been sort of part of the academic diaspora for all these years, I really feel this strongly about sort of that sense of connection. And I think what you said about academics needing to bring our whole humanity, I think that applies even more to natural scientists, because we're trained to think that that doesn't really matter in science, that it doesn't count towards science. So that's one of the things that I talk about in the context of decolonizing, is we need to think about who is doing the science as much as what the science is, because who you are shapes the kind of questions you're able to ask, and you only get answers to the questions that you ask in science. Even though we think science is all powerful and can answer everything, if you don't know what questions to ask, you're not going to get the answers. So yeah, I really applaud what you said, and one of the struggles for me has been, as somebody from outside communities trying to work with different communities, I'm trying to find ways to be able to do that despite lacking the deep roots in any one community that you described. I mean, yeah, people can know where I live, but I don't really have that sense of community where I live now, because I'm academic diaspora. I've lived in many different places in the US. I came to the US as a graduate student, and I've been, East Coast, West Coast, a number of different states, and always in the bubble of the university, but trying to engage in whatever ways I can.
Thank you all so much. This is already so enriching and so fantastic. And as we're talking about research and work in communities, something that we haven't touched on yet is health and health related work and research and how that pertains to how we are acting and intervening in communities as well. And so we'd love to turn it over to Dr. Irene and ask you about how you design kind of culturally aligned interventions in public health and how you work and deal in that space.
Yeah, thank you. I think it's not that much different than what Danielle and Cameron were talking about. And to their point, it's really important to be clear about your intentions when you enter a community, regardless of what you're doing for research. And they also made a point about creating a team or looking at assets of each individual. I think that's really important. Knowing what the strengths are of the individuals you're working with and not trying to duplicate that or inculcate your own research methods. On the other hand, we have actually focused our attention on some kind of training for people in the community when it's been asked for. So I'm jumping around a little bit, but I think it's important to create a team that includes community members as on the research team itself and to use their own strengths and assets. So we have worked with native speakers in Spanish and in other languages when I work with refugees to teach them about intervention methods and have used and paid these or compensated these members of the community well, not just relied on them as volunteers. So if that makes any sense, but I'll step back a little bit. I think one of the things that's really important is to know your population and the community you're serving. And some ways to do that are, as the other speakers have talked about, is to spend a lot of time understanding the culture and the belief systems of the community you're working with. There's ways to conduct a windshield survey, we call it. I don't know if you all use that as well, but just using your eyes and ears to kind of walk around the community, knock on doors, or just observe, familiarizing yourself with like physical environment and the realities of community and how what community members are living with. Conducting key informant interviews is something that we do a lot of. We find out who in the community kind of holds the key to certain knowledge, and we'll talk with them individually. We do community consultations where we'll bring together a group of people that might be interested in the subject matter that we're working on. Focus groups with community members. Those are some very specific things that we do. So just as an example of a pilot intervention I'm working on with refugees right now, I work with a resettlement organization in Durham, and the intervention is around mental health. And the reason we're doing this is because I was approached as someone that works with this community, with students actually, around what can we do in terms of alleviating psychosocial stress and other issues in a situation where Western mental health methods do not work with a population that doesn't really separate mental and physical health as two separate entities. So it's a long-term project, and I've been working on this since 2015, but the most current one is the development of the use of storytelling as an intervention. So to give an example of what we did, I was approached by the mental health professional at this organization, as well as a wellness coordinator. And we worked together to conduct a series of consultations and focus groups, first with the staff members to find out what their needs and their perceptions were. Then we conducted a focus group with Afghan male leaders in the community in the Triangle area. It's fascinating. And then worked with a focus group of Afghan women. So we collected people's perceptions, ideas, and thoughts about what type of intervention they thought would be important, what would work for them, what wouldn't work for them. And based on that information, we recruited a group of ambassadors of community health workers that are native speakers in the Afghan languages. And we are training them in intervention methods in the storytelling technique. So it's a long-term project, and it's something that takes a lot of time. It's not short-term or let's jump in and do this project, but we do a lot of background work on that. Another example is the SARE studies that I'm involved in. I'm a co-investigator there. We work with the Latino community, and we are looking at stress and health and resilience in that community. I've had a long-term relationship with El Centro Hispano and with the Latino community in general. And so working with PI, we spent extensive time working on different phases of this research and developing relationships and training community members in research and intervention methods, community health workers. And the same principles and methods are effective whether you're in the global or the local setting. So any project I've worked on in the global setting, I use the same kind of methods where getting to know the community, in other words, and really knowing the assets of that community as well as the vulnerabilities of that community. So maybe that's a little long-winded, but I think I'm talking to a group of people here that all believe in the same thing, that we have to respect community members, respect the knowledge and the deep cultural implications of what we're doing, and also be cognizant of the history of the institutions we're coming from, and to acknowledge that. I feel like Danielle and Cameron just sort of stole the stage there, and it was like a mic drop, so I'm not sure what else to say. Thank you for everything you said.
That was fantastic, Irene. Thank you so much. And I think it's something that Ankita and I were really excited about on this panel is that we have some folks that are working locally, some folks that are working globally in other areas. And so we're talking about this really broad definition of what it means to work with communities, whether you're living near them or you're far away, or it's communities that are newly implanted into an area that also aren't used to that area, or that's us as the researchers and we're not used to an area. And how do we do this work without parachute science and without just jumping in and asking questions that we shouldn't be? So all of these types of community engaged work are so interrelated in a sense, and health can be a really sticky place kind of for how to keep everyone safe and healthy while also having their needs met, especially if they're refugees coming into an area where they're also not used to being there. Another sticky place where there has been a lot of tough work in the past and work done without community involvement is conservation. And so Dr. Kati, you can speak so much to conservation. And we're wondering from you kind of how can community engagement inform conservation and ecological methods, and why is that so important for conservation work? And I know you spoke about that already, but any way that you want to expand or further that discussion or further the discussions we've been having.
Yeah, I have been thinking about this. A lot of my work is in the area of nature, biodiversity conservation, although I'm also struggling more and more with the terminology used and with the word conservation itself, because it comes from a sort of conservative place, I think, in terms of thinking about nature. And as I said, I grew up in Bombay, in India. I did my undergraduate and a master's degree there in wildlife biology. But even then, even though I was in a global south country, the model of conservation was very much the colonial model of fortress conservation, which the US has played a major role in developing that model with the idea of national parks and the concept of wilderness or national parks as places where humans don't belong. And I think that model has caused a lot of damage around the world to human communities, to people who've lived in these places for long periods of time, and sort of building this model of nature as being something that is a separate category from humans. That goes back to the colonial sort of enlightenment thinking philosophically of putting humans as a distinct category from nature, which also then lends easily to the colonial dynamic of humans as having dominion over nature rather than as being part of the community of all the organisms that live with us in these on this planet. So I have a lot of problems with the way conservation has developed, and I get into arguments with my colleagues about some of these things. Although I think a lot of the thinking has begun to change. So, in terms of what sort of or what role community engagement can play in transforming conservation, I think it goes back to what we've been talking about, what Cameron's been saying about the importance of people rooted in places who know the places being put in charge of protecting those places, right? So, and there is growing evidence now that when control of so-called national parks and protected areas, governance is handed in the hands of local communities, indigenous communities, conservation outcomes are better. There are studies showing that knowledge of population status of different animals, for example, is better among local communities than even scientific monitoring can show. There is research showing that in a number of places. So even the forest conservation, people have sort of moved to this idea of, maybe we need to co-manage, maybe we need to, build these models of co-management with communities. Yet that still comes from this sort of hierarchy of, oh, we're going to let the local community, partner with us, but we decide how the management is to be done. I think we need to break away from that. And I say that for two reasons. One is obviously because of the harm that's been done to the local communities when they are ripped apart from the nature that they've lived in for generations in the name of protecting that nature. But also from the nature conservation viewpoint, because I think more often than not, doing this has caused more damage long term to the nature that you're trying to protect as well. Because this comes from a place of not understanding that the people living in natural places are a part of that ecosystem and play important roles in managing those ecosystems. You remove them, you remove all the cultural and land management practices that they carried out in that system, that destabilizes the system. So you have the case of Yosemite, which is the point I made in that video I made for our students. Yosemite was created by kicking out indigenous people who used fire as a tool for managing the landscape. The beautiful landscape that was captured in those beautiful photographs that people have seen, that inspired John Muir to launch this campaign to protect this pristine place, not recognizing that what pristine nature they were describing was actually a result of people managing that landscape to maintain that park-like structure with the mix of trees and grassland. What happened when you remove people and the fires they used? You end up with uncontrolled sort of growth of forest there, which leads to a century of fire suppression, because that was the science that fires are bad for forest health. So science says you shouldn't allow fires. We suppress those, and then a century later, century and a half later, now we are still paying the price with these massive, massive wildfires that are destroying forests all over California. Yosemite's had, and Sequoia National Park have had disastrous wildfires that have even threatened giant sequoias, which are fire adapted species that have been around. There are individuals that have been around for 2,000 years or more. long-lived fire-adapted species are being threatened by fires because of this model of protection, which has completely destabilized the system in the long run. And I can give you more examples of that sort from other places where even the stated goal of conservation is defeated because of this model. And one last thing, the conservation model is sort of protected area model is based entirely on this sort of fixed relationship to land, right? Which is how the dominant mode of relating to land is anyway, that, we are all sort of talk about properties and national boundaries and so forth. So we put a boundary on a map around a place and say, this is a national park and nature will be protected here in perpetuity. What happens with climate change? As we are seeing, climate change means you might protect something physically in a landscape, but if the climate shifts, species that used to live there can no longer live there. And if you look historically, if you actually take a deep, historical look or prehistorical, sort of ecological or evolutionary timescales, we know science, from evolutionary research, we know that no species has ever had a static relationship with a piece of land until we came along and decided that's the way we need to relate with land. All relationships of every species with land have been flexible and adaptive. And with ice ages, with changes in temperature, with other cycles of changes that happen on this dynamic planet, the relationship is always dynamic and species have always moved in response to changes. Now the change is forcing human communities to also move. I mentioned that's something that I'm interested in looking at as well. But we are stuck in this very static model of conservation because of our static approach to how we conceptualize of land as property, I think. And I think that's at the root of a lot of our problems. And we need to sort of break out of that and think more flexibly about how do we enable landscapes to be more, porous or corridors and stuff people talk about, but we really need to think about sort of breaking that boundary between human and nature and allowing other species to move through these landscapes as the climate changes and figuring out ways to help people who also might be are being forced to move along with that. And yeah, we can't do any of that without engaging with people.
I'm hearing a lot of themes from conservation and health and working with local communities in Durham and wherever we are living that are kind of really coming back around and back to some of those same thoughts that Danielle and Cameron echoed in their first discussion. And Dr. Grace McCaskey, I'm going to ask you to kind of continue it back around because we really wanted to ask you about ethnographic and anthropological methods, which are some of the most community ingrained, and how those can contribute to this idea of community-centered and community-rooted research, both kind of on land and with ecosystems, and right here in North Carolina and in the US where you work as well. So we'd love to hear from you on that.
Thanks. Yeah, and I might kind of gear it a little bit toward directly following up on Dr. Kadi's comments as well. So, I became an anthropologist and someone who does community-oriented work like in reaction to everything that Dr. Kadi was just talking about. I thought that I was going to be more of a conservationist and that kind of thing. And the more that I saw how much valuable insight and information was not being used to manage our resources and to manage our environment, and to work in our communities, the more I realized the need to really take that community-centered approach. when it comes to, I sort of came at this through fisheries and fisheries management. And as a grad student, I really wanted to work with fishers and to collect local ecological knowledge, and to take that community perspective and that rich knowledge and be able to comment or find ways to where that knowledge can be used in our management processes. And while, that was 15 years ago now, and I think we have seen some changes, as Dr. Kadi even mentioned. I think people our managers, our policymakers, our scientists are more and more open to the idea of including that local knowledge. I think our systems are not built and structured in a way that truly allows for that. As a social scientist who often works in these interdisciplinary spaces, way outnumbered by natural scientists and economists and those folks. It's constantly, I feel like the qualitative work, the ethnographic work, the real understanding of community is dismissed as anecdotal, and it's not given as much value in those systems and those structures simply because it might not be quantitative and it might not be economic. How do you take cultural value and put a number to that so it can be used by the National Marine Fisheries Service, right? And is it even ethical to do so? So I think about this a lot in terms of the implications for management and that kind of thing. I think that there's a real mismatch particularly when it comes to resource management. And I would assume the same argument or statement could be made related to health systems or housing and economic systems. But we just have this mismatch where the dominant perspective is to monetize, is to quantify. And I think that really does a disservice to our communities and our relationship with nature, with each other. And so I think that is something that I'm kind of constantly coming back to with my anthropological hat on, which I don't even care, doesn't matter what discipline it is. That's what I was trained in for my methodology and my sort of theoretical perspective. But all of us on this panel are doing that work. So, but it's frustrating, right? Because I don't know how to facilitate that change or create that change so that our communities do have a bigger voice. And I'm also conscious of the time, so I'm going to kind of cut off there so we have a little more time for interaction or maybe other questions.
Thank you so much. This very lively discussion has, I think, prompted some questions from the audience. And I'll start with the question from Eve. I think it was directed towards Daniel and Cameron. And she asks, what administrative hurdles do you see on both sides of the table in the kind of work that you do?
So administratively, there's lots of barriers that can be placed on doing community-based research. We're often saying that we'll pay people on a invoice basis. So they do the work and then they'll invoice us and then they'll get paid, which is fine at the university where there's a wider margin of finances and buffer, but differs when you are working with community organizations. So we had to think through, when the grant lives at UNC, what are the ways that we are staying within the proper legal reporting? But there's so much information and consulting that goes on every time we're meeting with Cameron or others. That is something that should be invoiced, opposed to waiting until there's some big programmatic event and then they can be reimbursed for it. Instead, how do you make sure that administratively they are compensated from the beginning? I think we have shifted when possible, and then you're seeing more funders making this a requirement. For example, the Robert Wood Johnson and the People, Parks, and Power project that I referenced, universities could not apply for that grant. I think this is a wonderful model. Absolutely wonderful. Why? It shifts who holds the purse strings. And that is major economic power in saying and balancing. There's still going to be some imbalance about who is comfortable with bureaucratic language and figuring out how systems work that we still have to redress. But who holds the money is a major way of reshifting how a lot of those conversations go, because historically, the funding that's associated with research has been used to economically blackmail communities into doing a project that they otherwise would not use their time budget for. So there are a myriad of administrative hurdles. We once had a time when we were doing gift cards and was like, yeah, we need the social security numbers of everyone who gets a gift card. I'm like, oh, excuse me? You want me to get a social security number for someone who's getting like a $25? Like that feels like definitely like you are it's an overreach of that is it's not like when Cameron's organization does gift cards, it's not like they're also not tracking because they have to. But it's very different when the institution, UNC Chapel Hill, is asking for someone's social security so they can have a $25 gift certificate. Like we have to think, and in that thinking, we can reshift some of the administrative um, um, powers to a different place, but then the money also has to follow it. So it can't be UNC gets 50, I think we're at 55 plus overhead. And then we think that community organizations can do the same functions at 15 or 20%. Or we don't have any general operating funds that are associated with the grant. So we have to rethink all of those systems because it can't be that we're replicating what works at UNC because it works at UNC because they have a long runway when it comes to finances that is not going to be replicated for most community organizations.
And I'll add to Dr. Danielle right quick. So there's a couple of grants specifically where we're able to press against some of that administrative mess, specifically with Duke, with Dr. Kay Jowers and Andrew Foster at the Community Law Clinic and a couple other folks. So we had a grant, an additional grant with Robert Wood Johnson, not the P3 grant, where we were working as a pioneer in communities. And Robert Wood Johnson, along with Dr. Kelly Brunell, who is the founder of the Duke World Food Policy Council, worked with us to set up a contract where it cut down the overhead that Duke was getting. And then in addition to that, we also had very explicitly stated in there that all the IP that was created before to go into this process was listed very clearly. So we kept our IP pre uh, pre-contract, as well as the IP that we were creating within the contract was also stated that it would remain with us. And if Duke created IP, it would stay with them. Traditionally speaking, that is not what happens when you're dealing with community-based organizations. Intellectual property, yes, so sorry. And so that was a part of it because our framework, we have found, our framework has tried to be co-opted. Yeah, Brookings tried to co-opt it. And so we had to go like this and have a meeting, and and the only reason why we were able, and it's not uncommon for community rooted organizations to have their work co-opted by very powerful organizations. The only reason why we were able to actually stop that was because we had very clear relationships with who funded their project and they didn't know it. And so we were able to have a come to Jesus, so to speak, meeting and to get that taken care of. But looking at, yet again, infusing a power analysis in all the work that you do, and also in our methodology, scholars are considered community-rooted scholars. It's not just Dr. Danielle, it's me too. Because what we bring to this work, there's no way we can actually have a positive, true scholarly outcome that actually benefits humanity in a substantive way if both of us are not at the table and are acknowledging the power that both of us bring as being very, very, very central to the work that we're doing.
I think Dr. Feldman wants to add something.
Yeah, just to that point, Cameron, one of the things that maybe I'm preempting myself because it was an answer to the next question I had, but one of the things that we do is we include community organization members as our co-investigators on our studies, and I'm sure you do that too. We also will then compensate them for that. And the other thing, in terms of trying to get people paid at the local level, community health workers, sometimes that's really difficult to do that because of the Social Security issue. And we've been able to figure out a way to turn funds over to the organization itself, and then they pay in the manner that they can do that. I mean, that's probably not rocket science, but that's what we've done to get over those hurdles. Yeah.
Just quickly wanted to add on this question of administrative hurdles and so on is that we are in a regime now with whole new hurdles coming up or old hurdles being resurrected. So I think what we do in terms of community engaged work is going to be even more important because we can't expect help from above anymore. It has to be from the ground up.
Very true. I think we were talking about that yesterday on how we could do another panel talking about the new issues which might come up in the coming years. But as you're talking, Dr. Kati, do you also want to answer the question posted by Miguel on the reception by your colleagues and students about your decolonial approach to research?
It's a mixed response, I'd say. When my former postdoc Chris Trissos and our anthropologist colleague Jess Auerbach, who are both from South Africa, and I got together to write the paper that sort of set off a lot of my work in decolonizing ecology and decolonizing science. We were apprehensive about the reaction of our colleagues, but also as two of us are ecologists, so we're not that familiar with the decolonial literature and social sciences, and we were learning stuff as we went along on our own. It's not something that many of our colleagues are exposed to. And there are always, of course, issues of interdisciplinary understandings and misunderstandings and, the academic cultures being different and so forth. So we were apprehensive about how people might receive this, but also recognize that criticizing ecology or criticizing science for being colonial is easy. Right? It's really easy to point out the colonial roots of anything we do in science and criticize it. But what's more important is to take the next step of asking, what do we do now? If we accept that science as it's conducted is colonial, how do we change what we do? And that's what our approach was focused on. That's how we came up with the framework of shifts in 5 areas that can help us move towards decoloniality. And I think that approach made it more acceptable for a lot of people in the community. So in general, the response to our paper has been positive. And in terms of my work in doing workshops or speaking about this, what I generally find is that there is some resistance among older faculty. Not always, but you can guess the demographics that are resistant to this. And I find much more active engagement from early career researchers, graduate students. In fact, workshops that I've been invited to conduct have generally been by grad students on, DEI type of committees and so on. And I don't know how that's going to change with DEI being eliminated in many places. But in general, this is grad students, early career researchers, non-tenured folks, so people who are all in some positions of precarity in terms of their careers, are more willing to do this work than people who have the security of tenure, which is an interesting thing to think about, right? And so a lot of the discussions in my workshops often end up with addressing some of these tensions and conflicts that Miguel, you're asking about, because who you are and what your position is in the hierarchy of science is going to influence what kind of changes you're able to make. And we talk a lot about strategies for dealing with that. How does a graduate student, avoid doing helicopter research, especially, if you're a grad student at Duke whose uh, advisor has a research program in East Africa, you go and do the research there. How do you avoid doing helicopter research in that context, right? We can talk about that and figure out strategies for trying to stay true to that, even though it can be risky for your career. And this is something that came up in the previous panel, I think, also about how it's dangerous sometimes it's expensive or risky to engage in deep community rooted work, because that takes a lot of time that doesn't get recognized as valuable academic work, right? So what happens often is younger people, early career people, are not able to do that because you have to publish, you have the pressure of publishing, getting grants and so on, and you end up, being on that track. And then by the time you get tenure, maybe you're already set in that pathway, which makes it difficult to then pivot. And I've been on a slower career trajectory, maybe partly because I think like this, but there are costs and there are tensions and conflicts that we have to navigate. And of course, the landscape of conflict has significantly shifted in the last month, especially in the US. So we really need to think about what our positionalities as academics, as researchers, as part of members of society, as human beings who are trying to do our work in this context. If you're an academic in an American university, you can no longer pretend that you can do your work in an insular way in your lab, right? You can no longer pretend that you can be apolitical. The after the election, the president of the American Association for the Advancement of Science had written an op-ed in was it in Science? I think, yeah, basically saying that science is neither red nor blue and we can all do apolitical science. I don't think that person can, make that argument anymore, given what we've seen has happened. So we need to think maybe this is an opportunity to actually engage in deeper conversations about decoloniality, because the colonial structures themselves are collapsing in the current context. So maybe we can look at this as an opportunity. Cameron mentioned that, and Daniel, or both of you mentioned building our own table. I mean, now that even the other table is being taken away from many of us, so I think it's more important that we build our own table and start these conversations and breaking outside the academic boundaries that we tend to sort of feel comfortable in.
Lots of thought-provoking discussions happening here. I think we have another question from Danielle Doman, asking that in addition to what Cameron and Dr. Daniel mentioned about showing up and showing up whole as human beings, what missteps have you seen researchers make in community engagement? And this question is directed at whichever panelist feels comfortable in answering.
I might make one comment about that just because it triggered something in me. I am known in our department as someone that is deeply engaged with community and have been for a long time. It's been my career trajectory. And so I often get questions from people. How do I get into that community? Can you make networking? Can you network for me? Can you make contacts for me so that I can do my research there? And I find that I guess it's a teachable moment for colleagues, but I find it sometimes very abrupt and offensive, and in that I spend a lot of time getting to know a community and building trust, and to have that kind of tapped into in that way. So I just wanted to, that's what that triggered in me, that question. Thanks.
I can pipe in. One, I want to say hello to Danielle Doman, who has been doing a lot of work to push forward conversations from the community perspective about research in Durham around the park contamination. And so actually, I think you're the expert here, Danielle, in where those pitfalls are. The one I see that is when we do research for the sake of research.
Yeah.
In this case, they knew because of environmental unjust histories that incinerators have been placed in a number of historically Black communities. You're doing research about soil contamination. Again, not a bad thing, but there was no plan about dissemination. So when they found contamination, ooh, surprise, the pathway to get to the research to communities is it's a familiar story, but it's still a very disheartening story given that I know that Duke has actually invested in quite a bit of machinery around community engagement. And even within the Duke ecosystem, it still went left. So I think that's one major pitfall where you are going to affect someone's life with these outcomes. And that could be here, uh, exposure to heavy metals. It can be all of the implications of not having uh, good urban tree canopy. That means about air quality, about heating, cooling, energy bills. It is the damage that can be done as you're trying to find out about food insecurity. Having to ask those questions where someone has to tell a stranger about their food insecurity and then you just leave, that's a pitfall if we have no plan, one, about how, don't, not even just how I'm going to get the information back. Is there the next step that someone isn't then still hungry once they've given you your data, or someone isn't still at risk once you've given your data? So you've got your data. So even if you're still involved and yet you lacked the plan about what are the implications for what I find here, and how do I set up the community connections? How do I set up, you're not objective. You're not objective. And so how do you uh, not even do less harm? That's really what it comes down to. And if we haven't interrogated our process at each step about how you do, uh, we'd like to say no harm, but there's probably going to be harm there. But do you have a thought partner? Do you have another community-based scholar who's going to call you on that, and you do that problem solving and solution along with those who are directly impacted, rather than, I wrote this paper and now you have to deal with it.
And I'll add to Dr. Danielle, because I think most of us are people with goodwill and who want our humanity to come through in the work that we do. We are coming to a point in time that we have to realize that reason why there's pushback is not because we'd like to think that everybody is giving pushback simply because they think there's another way to have the outcomes that we all want. I want to pose that I think that we might be in a time that people don't want another way. They actually want the outcomes that we're seeing and worse. And that's the sad reality of it. So when you might be getting pushback, this is you and your own humanity, and as an academician or a researcher or a social scientist, you might have to come having a moment of truth in that reality. Because there's a reason why for decades, 3 cement factories have been placed in our community. And not too long ago, the Racial Disparities Division at Duke Health, we were having Black women and brown women coming up with cancer, breast cancer in their 20s and 30s that were, by the time we found out, was stage 3 and 4. There's a reason for that. and certain people kicked it into gear, wanted to do the people like you on this call, trying to figure it out, sitting with families, trying to figure out what we can do to save people. And other people just sat with their hands in their laps.
Well, thank you so much to all our panelists for giving your very valuable thoughts. And these are very deep discussions, which I think require all of us to think a lot about what we do and how we do what we do. Just want to quickly check with Dana and Julie on how long we have left for this panel. Do we want to continue with more questions or break for lunch soon?
I think Julie had said we could keep going until 12:45. That is, I know it's been long, so I think that would require if everyone in this panel gives a thumbs up and wants to and is able to. And you might not be able to, you might have, it's a snow day, you might have booked in lunch right now, and that's okay. So feel free to give us your thoughts, and we could go another 10 minutes, especially, I mean, Cameron, what you just said was so rich and it's so important and impactful. And so I saw Dr. Kati that you unmuted, and so if we want to do closing thoughts, and also please put in the chat and let everyone know your contact information if you want to be reached. And also our other thought was if there's anything that you will be going to in person, since we didn't get to meet in person here, if there are other ways that you like to connect. So anything would be super helpful if you want to plug a website or a paper. The Communities in Partnership website, for example, was fantastic and great to learn about the program that way. So maybe we'll do that in the chat. Feel free to say it out loud, and then we could just go to closing thoughts. And I guess Dr. Kati, I think you wanted to respond as well, or had a thought. So.
Yeah. Well, I've just been thinking about and listening to all the panelists and the work we're trying to do, and I'm looking at in particular at Daniel and Cameron's partnership as a model that all academics need to look at. We need to find our own Cameron to partner with in communities to draw out our humanity and to be able to connect with the work that matters in the real world rather than doing our academic work in sort of isolation or in our academic collaborations and producing papers that only your colleagues read and that have no impact on people's lives. So something that I tell my students and people in my workshops and so on is that there's a culture in academia where bringing up these issues is labeled as DEI, which is problematic. And of course, we are being told not to use that anymore. But I think that also is an opportunity to think deeply about what it is that we're trying to do, right? Putting a label on something and making it seem like something that's an additional thing that you have to do to meet some compliance is not going to get us to change our culture and the way we do our work. Instead, I think we need to really think about centering justice in all the work we do. If we come from the place of thinking about, is the work I'm doing, whether it's in the lab or whether it's in the field or whatever field you might be in, ask yourself if the work you're doing, and this is for academics, ask yourself if the work you're doing is going to make the world better for a broad number of people or not. Are you working to contribute towards the side of justice or towards the side of power? These are critical questions we need to ask ourselves. Are we upholding power in our work, or are we trying to uphold justice? And if we do that and start from that place, then none of this is extra work we need to do. to meet criteria of diversity or inclusion or whatever else you might think of. It's not extra. It's the heart of the work. So I think that's the sort of humanity we need to bring back into the way we approach these things. And I especially want to thank Cameron for reminding us of that.
Thank you. That was beautifully said. And I just want to respond to one thing you said, and that is that I feel that it's important to work with, as you said, community members as collaborators, and as authors, as co-presenters, given their deep knowledge of the populations they work with or represent and their contributions to the work. So, for example, I work with a former Bhutanese refugee. He's a journalist, an oral historian for his community, works with the Smithsonian. He's a health coordinator for refugee organization. While I have the perspective as a professional who's worked with refugees over the last 40 years, he has a lived experience, and he's a much more eloquent speaker than I am, quite honestly. And I feel deep respect for him. So I really resonate with what you said, finding the people that we collaborate with, that we can have a sense of humanity with. So thank you for all of your thoughts.
I can come in and just, I don't know, I think we're at a really challenging time, to say the least. Many of you might not be aware, our universities in North Carolina have had to get rid of any requirements for diversity, for my anthropology department right now is literally needing to change the wording we use because we refer to culture. I can't even begin to think how to come back from this. But I've been sitting here trying to think of sort of a positive way to end my thoughts. And I think I will say, so I'm part of we have an integrated coastal sciences PhD program here at ECU, and it is interdisciplinary. And I will say that our students, our graduate students, and this sort of reflects on what you were saying earlier, Dr. Kadi, about the more the up and coming, researchers and community members, right, of our world are more aware of and understanding of what I think we all have talked about that we're trying to do. The reality, even, they're getting a PhD, but most of them are not going to become academics. That's a dying breed. We really are. And I think it's encouraging and positive that our students at least are acknowledging the importance of this and doing this work. One of my PhD students was telling me how she's organizing a protest, and our young people are fighting back and continuing this work. And I don't have very collected thoughts on this, and I apologize, but I'm trying to be a little positive here. So, but I appreciate what all of you have shared, and I really appreciate the invitation. And I hope that we do get the chance to meet in person.
Thank you guys for inviting us to come here. My final words is just, we were talking about building I do think we're going to get an opportunity to build a brand new table. I think it's going to be a costly table and a precious table. And I say this all the time in response to I've been saying this for years because I grew up in the foothills of the North Carolina mountains. I'm from country Black people, very proudly from country Black people. I also grew up with poor white people who had way less than I did. I grew up moderately middle class. I was pretty well taken care of as a little Black country girl. But this work is not about doing to white people what was done to my people. That's not why I do this work, because I don't want to become the oppressor. And I've said this for a long time. This new table needs to be a table where we build our humanity, not in a colorblind way, but we learn from the mistakes of the past and the tools that we've used to dismantle other people's humanity. We need to take those to learn how to become more humane and loving and kind and uplifting the humanity of everyone. Learning from those mistakes, learning how we can humanize each other, do away with the otherisms so that it is not okay for us to go in and commit genocide against people and to make it against the law to speak about it, so that we can uplift every woman, so that all women can feel free and held open as to when they choose to give birth or when they choose to not. So they don't have to be in fear of their lives when they do decide, like Black women right now are. And we actually hold that up as a community. And if there's a problem that comes, we all come together to say we're going to uplift that humanity so that all women can have choices and that all men can have choices and that every child can walk down the street without being in fear of their life. And if this is what DEI means, then we're going to be in for a bumpy road. Because the fact that we can't talk about who's being dehumanized, not to the exclusion of other people, that's not what we're talking about. We're talking about centering and uplifting the humanity of everyone. And that's the work that I want to do. Not to the exclusion of other people, but to the inclusion of everyone. Because that makes me more human. That makes me safer. That makes me more whole. That makes me more healthy. Everyone. And that's the purpose of this work. So I hope that when we build this table, that we will all come together and we won't be afraid to talk about power, and we won't be afraid to talk about history, and we won't be afraid to talk about how we have been programmed to dehumanize each other based upon racialized stereotypes. But we uplift the true humanity of everyone. That's the table that I want, and that's the table that I want to build. And so I hope that you guys are going to use that opportunity in these institutions to rebuild this table in a more humane way. Thank you for all the work that you do.
My only thing, practice the way you play. If you want that future, you have to do it every day. And it can't be once I am here, I will act differently. That intention and action connection has to be in our daily practice. Otherwise, we do open ourselves up for those pitfalls, for those moments where you justify action that does harm. So practice the way you play as we are getting to that point where we're building the new table together.